Hello and welcome to Diaspora Clinical Education's Infectious Diseases podcast. I'm your host, Kristen FharmD. Today's episode discusses improving shingles vaccine uptake. I'm joined by Dr. Jam at the University of California, San Diego, Dr. Ruth Carrico at Carrico and Ramirez, PLLC, and the University of Louisville, and Dr. Dalilah Restrepo at the University of California, Irvine. To view the full educational program, including the accompanying text module and downloadable slides, please visit the show notes for this episode. Now, let's get started with Dr. Restrepo.
So the three major areas for shingles vaccination are raising awareness, really, of how important this disease is, the burden that it carries, especially in older adults, and how safe and preventable this really is. Ensuring the series completion because your immunity will wane with only one dose, and lasting immunity is really conferred with that second dose. That is the importance of giving the second dose, and addressing the disparities in the access to the vaccine and patient acceptance, and administering the vaccine in conjunction with community programs.
So thank you, Dr. Restrepo. I want to really focus on these three major areas of emphasis that you just described as we try to think about how do we make this happen and get patients over the finish line once we recognize their risks, recognize the clinical indications for an individual patient, and then how do we make this happen across not only primary and specialty care, but I want to make sure then that we're able to think about and consider the critical nature of the use of our pharmacist colleagues in making this happen. So first, let me talk a little bit about the coordination between primary and specialty care. And I think many times we tend to think about vaccination as only occurring in one setting, maybe internal medicine, family medicine, preventive medicine. But we also recognize that many, but although not all, of our patients will receive care outside the primary care setting. Perhaps it is in a particular specialty, pulmonary, cardiology, endocrine, or an alternate setting of healthcare, perhaps urgent care, or maybe we have individuals that are residents in a long-term care facility. So we need to be thinking about what are the approaches that we might be able to use to think about how to best coordinate this care. And I think then it starts with having vaccine-related discussions. This discussion needs to happen anywhere a patient is seen. And I think CDC recommendations and guidance have said, we really need to think about any time we see a patient as an opportunity for vaccination. So regardless of where that patient is seen, how do we have those discussions? How do we make sure that we are screening patients appropriately, that we're not only looking at the age-based recommendation, but we're doing just exactly, Dr. Restrepo, as you have said, let's think about what are the considerations in our patient population. So, for example, is this an individual who has immunocompromise? Do they have immunocompromise because of an underlying medical condition, or maybe it's because of medication that they are taking? So there are a number of opportunities to think about when to have that conversation. And I think it goes back to thinking, instead of having a patient opt in to a discussion about vaccination, we really need to be thinking, is there a reason why we shouldn't be having that conversation with a patient? And if your patients are like mine, very few of them would opt out. So that means we need to be thinking about any time a patient is seen, regardless of the setting or under the circumstances of care, we need to be having that conversation always. Equally important is remembering that the entire healthcare team is involved. So earlier I mentioned the importance of starting that conversation at the time the patient checks in to a practice. So you may find within your practice setting that it's helpful to have scripts developed for various members of the healthcare team so that they know exactly how to broach the subject of vaccination, and that you have some standard FAQs. For example, if patients offer information or they have questions, how are you best going to address these questions initially? And then how do you pass off the information behind the scenes to providers so they then can take up the discussion? You may be looking at text messaging or information provided through patient portal. so that you can prepare your patient so they are then aware about information about vaccines or vaccination, how your practice is going to use that. So making patients aware, making sure that resources are readily available, making sure that we are equipped to ask and answer questions, that we have policies and procedures such as standing orders that make it easy to do the right thing. So that whole notion of bringing in human factors engineering, how do we make it easy for the right thing to happen and difficult for the wrong thing to happen? And by best engaging our entire team, we can do that. So, Dr. JM, I want to pass this on to you and get some of your thoughts about the critical nature of a pharmacist role in making sure that we have access and administration of this vaccine.
So, what we can do in the pharmacy is first and foremost, we can identify those ideal candidates. In a very perfect world, we would have that beautiful coordination that Dr. Carrico described, where the physician or the nurse practitioner can call the pharmacy, let us know they're sending someone, and then we can have that vaccine ready. But consequently, our world is not perfect. And oftentimes that isn't the case. So what we can do is we can run reports on those individuals that may be 50 years or older. So those groups that Dr. Restrepo talked about, or those that may be immunocompromised. And we can consider who are those folks that haven't been vaccinated that we can go ahead and encourage to get that done. We can also look at the medication list for any immunosuppressing medications that may indicate that need for vaccination. So if we see folks, we may not be able to quickly grab the fact that they're immunocompromised from their patient profile history, but we may be able to pull that from the medication list that they have. We can also provide education. So a big area for limited vaccine uptake, something that we have to consider is that it's the fact of the matter that individuals don't have education on the virus and then the awareness that the vaccine actually exists. And then we can encourage and provide vaccination. As Dr. Carrico said, we absolutely want to make sure that we are given a strong provider recommendation on the vaccine. This is a vaccine that is available. It has been shown to be safe and effective. You can get this to prevent herpes zoster. That is the exact conversation we can have. We can determine whether co-administration with the vaccine is possible. RZV can be co-administrated with the flu vaccine and other annual vaccines. So that's an additional opportunity to increase vaccine uptake is to say, hey, I see you're here for your annual flu vaccine. You can also get RZV. It's safe, effective, and you can receive that with your flu vaccine. Irrespective of pharmacist setting, I believe that we have an opportunity to increase vaccine uptake. So the roles of pharmacists are ever evolving, and we're not just based in the traditional community setting anymore. We also have ambulatory care areas or care that pharmacists provide. So we can provide those vaccines right there in that clinic that we may be conducting, whether that be outpatient, whether that be in primary care, cardiology, pulmonology, endocrinology. I know a lot of times in the endocrine clinic that I would participate in, we would go ahead and we would offer vaccines right there because that was a perfect opportunity and a very perfect population that needed to be vaccinated. Also, we can go ahead and indicate when the vaccine is needed. So say a person is just diagnosed with diabetes, we can tell them that diabetes is an immunocompromising disease state. And with that, these vaccines are important. And then we can also partner with community-based pharmacies. So I work in a more ambulatory care fashion, but I partner with community pharmacies to provide vaccines. So we show that broad scope of what pharmacists can do in different capacities. And then also for our pharmacists that may work in transitions of care, we can go ahead and we can assist with any referrals for medication management that may be given post-discharge. We can partner with local health systems, and we can also partner with local health departments. So there are opportunities for us to leverage multiple entities there. And then we can also recommend vaccines to prevent rehospitalization due to subsequent illnesses. So there's a lot of ways that we can step in, we can support there.
Excellent. What about the need for that second dose? So getting the series completed is an issue. So having a discussion about how do we get our patient back in? Then how do we make sure that we talk with our patient about understanding when they receive the vaccine that we have immune responses to the vaccine? So ensuring that we are doing appropriate patient education. So whether that administration of the vaccine occurs in a clinic setting, whether that's occurring in a pharmacy, how do we make sure that we let the patient know what they may expect, that they may expect not only the typical pain and soreness at the site, But how do we make sure that they recognize that they may or may not have symptoms beyond just local pain, that there may be some reactogenicity? They may feel the effects, maybe fever, maybe back pain, maybe myalgias, maybe GI symptoms, that these are anticipated immune responses to the vaccine, so that we have a conversation with the patient so they don't think, oh my gosh, something went wrong. No, actually, something's going right. And making sure that they are confident. And then that may support then the return for that second dose of vaccine. So making sure that we're able to address that by upfront patient education, but also, do we have a way that the patient can call the provider back if they're worried? So giving them that information. And then, I always think about whenever I'm doing anything in a practice, if the outcomes are important to me, then I'm going to measure how well I'm doing. So, how do we measure what we treasure? If we treasure completion of that series, then how are we measuring how well we are doing? And then are we taking the results of that measurement, those metrics of success? And we're having then conversations within our practice setting to say, here is our rate of either in the provision of a first dose. Here is our rate of completion of that series. So we can evaluate how well we are doing and then come up with improvement processes. So that iterative process of measuring how well we are doing and then determining how well we are performing. So Dr. Restrepo, can I go back to you then again and talk a little bit about the side effects, or we oftentimes think of them as adverse events, or, how do we convey that information about those side effects to patients so we can do our best work with them? Can you talk a little bit about patient counseling?
Yes, I think I agree with you that upfront education is really the way to go. I think patients are more open to hearing what could possibly, what am I to expect, right? So many patients of mine will ask me that. So, okay, I'm getting the vaccine. What should I expect in the next day or two, or what's going to happen? And when they are prepared and when they have a game plan and when they have a backup of call me if A, B, and C doesn't work, it is much better received. And they can, when you anticipate something and it happens, it's not as scary as when you haven't even been warned about it. So many times, actually, as providers, we feel that we shouldn't mention everything, but actually it is a good thing to mention things up front. So one of the biggest adverse events that you can expect with this is really the local pain of the arm with redness and swelling and myalgias, fatigue, and headache. These probably happen in almost half the patients, if not more. The pain at the site is probably up to 80%. Your arm will hurt, but you have to remember why you are doing this, right? And that these side effects are short-lived. So these are usually 24 hours, 2 days max. They can be relieved with over-the-counter analgesics. And usually I advise my patients to drink plenty of water, stay hydrated, maybe refrain from vigorous exercise and rest for that day following. I usually counsel my colleagues, especially because we have long work days, not to get these vaccines, maybe to wait till Friday if they're off the weekend and kind of have a day off the next day, just in case you're feeling that fever, that myalgia, that arm pain, maybe you don't have a full day ahead the next day. I mean, these are just kind of small practical things, but sometimes just the timing of it might be important. And encouraging patients to get that second dose, even if they've experienced any adverse event. So that sometimes is a little bit more difficult. If you've had a very serious reaction, or you've had fever and myalgias, or you're 24 hours and not feeling well after a first dose, it is sometimes harder to get patients to buy into that second dose. But it doesn't mean that because you've had a reaction on the dose 1 that it's going to be repeated on dose 2. And many times patients actually, I mean, once again, when coaching them, they will just complete it because, again, if you went through the pain of dose 1, you want to make sure you have lasting immunity. And so that's really one of the selling points there. I think that's all for me.
Now, Dr. JM, our pharmacists have spent an incredible amount of time counseling patients. And in fact, much of what I learn about counseling patients, I learned from my pharmacy colleagues because you have done such an incredible job in doing that. Can you talk a little bit about how we counsel our patients some of the talking points regarding the benefits of vaccination and how we may approach some of these issues that Dr. Restrepo has talked about.
Thank you so much. So, yeah, I completely and 1000% agree with what Dr. Restrepo said. I think a lot of times we get nervous about going ahead and ensuring that individuals know the full scope of the adverse effects or the side effects that can be associated with the vaccine. But I tell them everything. In addition to that, we also want to talk about just how effective the vaccine is in preventing reactivation. A lot of times I'll get folks that say, well, I've already had shingles before. Why is it that I need to be vaccinated? Well, that vaccine can go ahead and prevent that reactivation, and it can prevent future severity should you have the infection again. So, definitely a big point of conversation. We're also seeing an increase in the emergence of literature that talks about the benefits that the zoster vaccine can have, especially for folks 60 and up. When we think about neurological diseases, so dementia and Alzheimer's, we do see a reduction for folks that have received that vaccine. So that's another big conversation point that I have with patients. Hey, this can reduce, the opportunity of the development of future or disease states. So that's also important. And also that reduction in major cardiovascular events or reduction in stroke activity and so on and so forth. So many benefits there. And while we do have to talk about that risk that may be associated with receiving that vaccine, I think a big thing that I always talk about, because we talk about those risks, I say, well, the benefits outweigh the risks that may exist. So that means that we go ahead and we consider that vaccine. So, with this being said, one thing that we do see, and we brought this up a bit earlier in the conversation, is disparities in the shingles vaccine access and uptake. So, I'm super excited to get into that today to go ahead and talk about that with everyone. So, when we think about just addressing those biases that may be relevant to vaccine hesitance, or we think about the fact that we can see that optimism bias. I rarely get sick, but if I do, it is always mild. That is a consistent thing that I hear in the community. Oh, I never get sick. And if I do get sick, then it's mild. But people don't consider as we age, our bodies and our immune systems, they just don't work the same way that they used to. And the way that you got sick at 35 may not be the way that you get sick at 66. So that's a conversation that we may need to have. Confirmation bias. I read the vaccines don't really work. So if I have a low risk of getting the virus itself, why would I get a vaccine that doesn't really work? That's how the conversation typically goes, right? I'm afraid of the vaccine, so I haven't gotten it, or I may be afraid of needles, so that omission bias. And then social norms. Nobody in my friend group is vaccinated, so why should I go ahead and why should I be vaccinated? So how can we go ahead? How can we combat these things? Well, we can do visual storytelling. My mom says that's one of my greatest traits. I'm a storyteller. That's what I love to do. I don't know if it's good or bad. So when we think about just the storytelling, we can say, well, the more you can picture something, the more important it is. So as you can talk about, as I kept thinking about when Dr. Restrepo talked about the presentation of shingles, the vesicular rash, and I'm like, oh my goodness, that probably feels very terrible. And then the other types of manifestations that shingles can have. Well, we can say, think about how that would feel. Think about that pain it would cause. And one thing that I saw in the community is everyone had at least known one person that has suffered from PHN, and that was enough for them. That one testimony of my brother had post-herpetic neuralgia, and he hasn't had the same state of life since. Well, that now has become, that story that sits in people's minds. And now they think about, well, the vaccine can prevent this. This is something that I maybe want to go ahead and get. So we can storytell. We can talk about instances where we've seen that presentation of shingles and how that vaccine can be preventative. And then we can also reframe vaccination as avoiding loss. At the end of the day, a big part of the human experience is community and being able to socialize and integrate with other individuals. And we don't want to have to do that being hospitalized or having long-term complications or being sick or not being able to go to work and losing out on your income. That's a conversation that I also have. Not only are these vaccines, good for preventing complications, but they're also good for preventing hospitalization. And they can also allow for you to be able to further integrate with your family and loved ones. So what can we do to encourage vaccine uptake? Well, we can go ahead and we can do motivational interviewing. We can ask our open-ended questions. We can reflect and then respond. We can affirm and validate, ask, provide, and verify. And then we can summarize that interaction that we're having with individuals. And then we have some just guiding points for getting our patients on board with vaccination. So we have AIMS and we have SHARE, which are two different frameworks that are evidence-based. So when we think about AIMS, we can announce that the vaccine will happen, assuming that folks are ready for it. We can inquire about the patient's concerns as a way to understand the patient. We can mirror the patient's concerns, repeating back what they've told us and asking them if that is what they meant. And then we can secure, so we can trust at the conclusion of the conversation that we've been able to validate and explain how that vaccine works and then go ahead and encourage that uptake. We also have the SHARE framework that has been developed by the CDC, which is a 5-step process for shared decision making. And I think every type of vaccine conversation should be one of shared decision making that we make with that patient. So we can first seek that patient's participation in that conversation. We can help the patient explore and compare options. We can assess the patient's values and preferences. We can reach that decision, and then we can go ahead and evaluate that patient's decision. One thing that I do, and I learned this from a colleague actually, her name is Dr. Rabia Tayi. I hate to take the credit for this, but one thing that she says she always does in her practice is a yes and approach. So what she says is she listens to what it is that the patients bring forth. She says, yes, you've heard this information. We're not going to invalidate that you've heard this information. And after that, and she provides factual information based on the topic. I think that's such a great way for us to approach the vaccine, especially in this climate. Yes, you may have heard X, Y, and Z. And then we can go ahead as knowledgeable providers and provide that information that we have. So we also have other strategies that have been shown to improve vaccine rates. The ACP recommendation is one of the strongest predictors of vaccination. So please, please, please remember that. I actually recently did a RZV study in a non-Hispanic, mostly Black community. And what we saw were that more than 50% of the folks that participated had never received a recommendation for the RZV vaccine, didn't even know what herpes zoster was. Most of the participants were 55 and up, meaning that we have some work to do there. So we can set up recall and reminder systems. We can go ahead and have standing orders and protocols. We can give incentives. We can work to reduce patient out-of-pocket costs. We can talk about the fact that if you are 65 and up, this is covered in Medicare Part B. So many patients do not know that. That cost factor can be prohibitive, but we can bring up the fact that there are coverage opportunities, and a lot of private insurance companies cover for the vaccine too for eligible patients. We can pair with culturally concordant and system-based interventions and also community-based interventions, similar to the one that I described. So specifically for the non-Hispanic Black community, as that is the community that I identify with, I have worked with a community-based organization to develop a community-based approach to increase vaccine uptake. It started during the pandemic. We said, well, we got some wind, let's keep moving. So with tier 1, what we start with is engaging faith leaders. So I work with the community org to reach out to churches and faith leaders where we work to see if we can conduct a educational intervention there. And then tier 2 is when I provide that education within the community. So we identify 4 churches from September to December. We go into these churches. We do a 45-minute education session to talk about preventable viruses. And then tier 3, we actually provide those vaccines that we talked about within those clinics. So we really try to address those barriers in one setting. We address the education limitation, and then we also address that access limitation, all in one full sweep. So when we do tier 1, as I discussed, I work with a community-based org to do this. And what that community-based org does for me is they really facilitate, my communication with the churches, my communication with the parishioners. When we think about the United States, especially for minoritized communities, faith leaders and community in general play a really, really big role. So it's been so great for me to not only work with the community, but to learn from the community in this way. We also do a survey-based study where I'm able to collect perspectives on how folks feel about the vaccines, if they've received previous education, if they have previous knowledge of them. So tier 1 has really been very impactful. So with tier 2, what we do is we provide vaccine education. So when I'm providing this vaccine education, we talk through all of those points that Dr. Restrepo and that Dr. Carrico brought up. So we talk about the pathophysiology of the disease. How does herpes zoster look? But more importantly, how does herpes zoster look on darker skin, because sometimes it's the lack of a diagnosis or knowing how it's supposed to appear. And that is what prevents individuals from being diagnosed, which then can lead to those long-term complications. Then we talk about just the mechanism of the vaccines. I don't mince information for the community because I respect my community enough to ensure that they are educated on every element of those vaccines. So what I do is I translate the information in an easy, accessible way, but I don't dumb it down. I'm sorry, that's just me. I don't subscribe to that, but I talk about the mechanism of the vaccine, how they work, and I also talk about the fact that an adjuvant is included in that zoster vaccine. I think that's an important component, and I never want for someone else to bring that up in the community, not have been aware of that. I also talk about just those adverse events that could be experienced, considering that a lot of times it can be that folks experience those myalgias or arthralgias, which will keep them from getting that second dose. So I talk about that importance of receiving that second dose, but I also want to let them know what to expect. As Doctors Restrepo and Carrico said, I don't want to mince that because I don't want that to be the limitation for uptake. But I think the biggest part for me is really talking about the impact of zoster and the minoritized communities, because I don't think that folks are aware of just the complications and how folks that are minoritized are more likely to experience them. So I really work hard to make sure that they have that information. So what we have seen is an increase in the willingness to receive the vaccine after we've conducted these informationals. We've also seen folks go ahead and be vaccinated against various diseases directly following the education. So it's definitely been such a great moment of growth. I'm actually preparing the publication for this for submission this week. So hopefully by the time you all are hearing this, we have a good review. But it's been a fruitful experience. So for tier 3, we provide these vaccines and we really try to take out a lot of limitations. So we take out the fact that, digital readiness or people being able to reserve spots online could be a limitation for receiving vaccines. We do it on site, so that's not a barrier. We take away the transportation need because if they're already at church, then they already have the opportunity to receive that vaccine. And we're also limiting that distance to healthcare facilities. I work with an independent pharmacy to do this. That independent pharmacy provides a lot of their own individual services as well. So for that second dose, which Doctors Restrepo and Carrico discussed, we try to make sure that folks come back for that. So the pharmacy themselves, they actually call the folks that receive the first dose and tell them, hey, time to come back for dose 2. And then we also really try to take away that discrimination and stigmatization. We really work to make this such a great setting. We work to make it comfortable, fun. We want for people to associate vaccination with a good time. That's my biggest policy. You come here, you have a good time. So we want to make sure that this is a decision that they continue to make. Vaccine uptake is a decision that is continued and long lasting.
So it's been a delight to have this opportunity to have this in-depth discussion. And I hope then that those who are listening are able to take away then a number of pearls and are able to implement this within their individual practice for the betterment of individual patients in our communities.
Thank you, Dr. Jam, Dr. Carrico, and Dr. Restrepo, and many thanks to you, our listeners, for joining us. To view the full program, please click on the link in the show notes. To get access to all of our new episodes, subscribe to the Diaspora Clinical Education Infectious Diseases podcast wherever you get your podcasts. Thank you and have a great day.